Welcome. I'm Dr. Lazar. This is our back pain and sciatica solutions workshop, and you are in a great place. We're going to give it about 2 minutes or so. We've got some people that are going to be hopping on, and so anyway, you can join. Give it another minute or so, and then we will be good to go. If you can hear me and you're watching this live, I would be super grateful if you would be willing to put a GTG on the chat and just let me know that you can hear me. So that would be awesome. And it is going to be a really, really simple workshop. And here's why. What we found in the past is that the more stuff we throw in, as far as, it being confusing or lots of information, it just gets really, really cumbersome, and we don't want it to be really cumbersome. And so this is going to be a really simple workshop because we want to make sure that you have the tools you need to succeed at this. So it's you and me. We're chatting. I'm looking at the participants here. Because I am referencing notes and giving data, I'm not going to be able to see if you have questions right away. So I will check those at the end. All right, so we are going to get started. This is going to be really awesome, and thank you very much for being here. All right, so let's get going here. If you are joining live, I would love it if you would share where you're joining from. If you're local, we're in Ann Arbor, that would be great. If you're not local, tell us where you are. So, all right, we are rolling. All right, got everything up. So Doug had come into our office and he was getting great results with our care. And we were really glad that that was the case. And he asked us, do you think you could help my dad? And we said, well, Doug, we're not entirely sure, but certainly we're happy to take a look and see if maybe that's something that we could do. Well, he couldn't get his dad to come in and see if we could help. Well, that bummed us out because we thought maybe we'd be able to help Doug's dad. So his dad is in a wheelchair. He's not walking properly, and he's got surgery scheduled. So we say, hey, this is not a good scenario. Well, Doug was frustrated and he said, I'll see what I can do to get my dad to come in. We said, Doug, that's a great idea. So he finally got his dad to come in. And I did a consultation with his dad, and his dad said, listen, I've got my surgery scheduled. I'm not interested in doing anything other than the surgery. I said, well, that's okay. But if there's a chance we could help you until the surgery, do you think we should find out? And Doug's dad said, you know what? That's reasonable. So we did a posture check. We did nerve scans. We did x-rays. And we found very clearly the cause of Doug's dad's problem. We'll call him Mr. Jones. We found the cause of his problem, and we got him started on a corrective program of care in our office. And over the next, couple of weeks, he started realizing, hey, I don't have to be in this wheelchair anymore. I can actually use a walker. It was a huge win, but it didn't stop there. And we could see hope coming back to Mr. Jones, his face, his demeanor. He was dressing differently. Really, really cool. He started experiencing hope again. And then a few weeks after that, he started using a cane instead of the walker. And then a few weeks after that, he wasn't using the cane at all. And so from the time he started until the day his surgery was scheduled was about 6 weeks time. So he went into see his orthopedic spine surgeon for his preoperative procedures. And because what I told him was, don't cancel your surgery. I'm not saying you have to cancel your surgery. Let's just see if we can help keep you comfortable in the meantime. Well, he got great results, and his surgeon, a great friend of mine, awesome guy, said, you know what? If you went from a wheelchair to a walker to a cane to nothing, we don't need to do the surgery. You're getting good results. Now, Mr. Jones wasn't completely pain-free by that 6-week mark, but he knew that he was getting enough results that he didn't need to continue with his surgery. And so he canceled his surgery, and we were really grateful for that. Well, the story doesn't end there. About a year later, Mr. Jones had a suspicious spot on his nose, and he went to his family doctor, who sent him to the dermatologist, and the dermatologist said, we have to test this. We think it might be skin cancer. And that's not news anybody wants to hear. So what they found was that the spot on his nose was cancer, and they had to take it off. So to do that, they gave a small injection of lidocaine into his nose to numb it. And then they cut the piece of cancer off his nose, and they sent it into pathology. But when they gave him the injection of lidocaine in his nose, it actually stopped his heart. Nobody knew, but he was allergic to lidocaine, and it stopped his heart. And he ended up going into cardiac arrest. They saved his life, thank God. I don't want to let that linger too long. The story ends well. They ended up reviving him, getting his heart to start back up. But here's the really powerful part. Not knowing the extent to which this statement was going to be a huge deal, the dermatologist put her hand on his shoulder and said, it's a good thing you've never been under general anesthesia, because if a little shot of this lidocaine, the local anesthesia, stopped your heart, there's no way you would have survived being under general anesthesia. Okay, great. How does that relate to my back pain or my family member's back pain? And the way that relates is, if Mr. Jones' son did not come in, did not have conviction, did not bring his dad in to see if he could be helped, and then his dad not get the help that he got, he would have undergone back surgery. And when they put him under anesthesia, he would have died. So literally, because his son was willing to have the conversation, Mr. Smith's alive today by the grace of God and never had to have back surgery. His life was saved. Now, you may not be dealing with back pain that's that severe. Maybe yours is just a little bit, or maybe yours just feels a little off and you're not entirely sure if it's even a problem. Like, if it ain't broke, don't fix it, right? Do we really need to do anything with it? But we want to make sure that whether that's you, or whether you have a severe problem, or whether you've had multiple surgeries already, you're in the right place if you're watching this workshop, because we believe that your health matters and nobody should live in pain every day. And that today could actually be your new beginning. For the last 13 years, my team and I have helped thousands of people just like you get off drugs, cancel surgeries, and to date, 16 people, 16 people have canceled their suicides. And we are so grateful to be able to serve people in that way, because pain is really miserable. It robs us of connecting and relationships and planning and our future, and travel, and our hopes and dreams get questioned and then squashed. And we want to do something about that. And so we believe that your family has the right to see if there's an underlying cause that's getting worse over time. And we'd love to see if we could help improve your health and help you feel better every day. So in the next 30 minutes, I'm going to talk to you about 3 things. That's it. 3 things. I'm going to talk to you about alignment. I'm going to talk to you about blood flow, and I'm going to talk to you about cellular repair. That's it. And by the end of this short workshop, you will know for sure whether or not our solution to sciatica and back pain is worth you looking into. So, number 1, the first thing I want to talk to you about is cellular repair. And the reason I want to talk to you about this today is because this is one of the 3 most important factors in eliminating back pain at its source. And cellular repair is a very small level. So we're going to start small and go big. So on a cellular level, if there's inflammation, if there's carbon dioxide, if there are waste products in your bloodstream, in your cells, then what we find is that the inflammatory process makes it so those cells are actually staying and causing more inflammation. And so if we can get proper cellular repair, then we can do that. We can help reduce inflammation at the source, at the cause. And so if that's the case, what we use in this scenario is a high intensity laser. It's got 4 wavelengths of laser light, and it goes deep 8 centimeters into the body. And it actually, this is really, really, really cool. It gets water out of the area, so it reduces inflammation. But it doesn't do it like pain medication does. It does it because pain medication just blocks the signal, and it can cause a situation, which we'll address next, where the blood vessels start to shrink down and restrict blood flow to the area. And you think, well, that may be good because I don't want a lot of blood in the area because that's going to cause too much inflammation. Well, you actually need blood to carry hemoglobin and iron and other nutrients to help heal the damaged area. But you don't want a bunch of water because that creates swelling and inflammation. So we want the swelling and inflammation to go down, but we don't want to restrict the blood from coming in. Again, we're going to talk about blood flow in the next point, but it really does all tie in together nicely. And so if we can do that, and then we also, with one of the wavelengths of the laser, we target a product called cytochrome C oxidase. Don't worry about it. You don't ever have to know that word again, but it helps produce, it speeds up the production of ATP, which is the fuel produced by the mitochondria of your cells. And all of those fancy terms just mean that your cells will literally have more energy to heal faster. And in fact, we find that the healing time reduces by 75% when we use the high intensity laser. Now, that is a real solution. We use it all day, every day, and it is a phenomenal solution to back pain. Everyone else is telling you that drugs are the only thing that reduces inflammation, right? The non-steroidal anti-inflammatories like Motrin, ibuprofen, Advil, those Aleve, those are a group of NSAIDs. Or they're saying that you've got to have injections to reduce the inflammation. But that's not true. What I'm telling you is that you can actually reduce inflammation without blocking those helpful feedback signals with our high intensity laser, meaning you're not blocking the pain, you're not numbing it so that you can continue to injure it more. You're actually reducing inflammation on a cellular level and helping the cells repair at a much faster rate. So that is hugely important. If we can have proper cellular repair, we do that with high intensity laser therapy, then you can reduce inflammation, improve cellular function, improve mobility, and it's a really, really, really great help. So that's the first thing is cellular repair, and we do that with high intensity laser therapy. The second thing I want to talk to you about tonight is circulation. Because blood flow can bring healing oxygen and nutrients to the area while removing toxicity buildups in the area. Overlooking this will only partially allow you to address your problem. In other words, if you don't pay attention to proper blood flow and getting oxygen and nutrients to the cells and waste from the cells, you're not going to completely address this problem with sciatica and low back pain. So while the laser addresses it on a cellular level, now our circulation device, it's called a BEMER, B-E-M-E-R, our circulation device, it helps in the region to improve blood flow and increases oxygen by 30%. If you've ever heard of hyperbaric oxygen therapy, that improves oxygen by 7%. This improves oxygen in an area by 30%. And Oxygen and inflammation cannot hang out together. So if we're hyperoxygenating the tissue by allowing your body to move more oxygen to the area, we're not infusing it from the outside in with oxygen, but the Beamer patented signal helps improve blood flow through the capillary beds, and that's where the oxygen and nutrient exchange happen and where the waste and carbon dioxide is removed from the cells. It is a fantastic solution, a fantastic help for low back pain and sciatica, and we're all about addressing problems at their cause. It's important, very, very, very important that you address this blood flow issue and this vascular issue and the movement of those blood vessels. They are under neurological control, which we'll talk about in the next point, but it's important that you're addressing this now, and here's why. If you don't address it now, then the effects of chronic stress and aging will continue to break down your blood vessels and make them so they're not as pliable. That is, by definition, the aging process. When you start to see wrinkles, when collagen and elastin aren't as present any longer, the telomeres at the ends of our chromosomes are starting to short, that is the aging process. But if we're actually applying therapy, this frequency therapy to your blood vessels, it is reversing the effects of chronic stress and aging. It's mitigating the reduction in elasticity and pliability, if you will, the softness of your blood vessels. Think of it like therapy for your blood vessels. Very, very important. And if you let this go long term, the problem is that the effect will be much harder to repair in the future. And so preparing your blood vessels now will actually increase your quality of life right now. It'll reduce inflammation, it'll reduce pain, it'll increase energy, it'll help you sleep better. And by the way, if you're in a lot of pain and you're not sleeping well, you know exactly what I'm talking about. It is miserable to try to sleep really well when you're in pain and you can't find a comfortable position and pain is shooting down your legs. If you reduce the inflammation now, increase your quality of life now, sleep better now, have better focus and mental clarity now, it helps you now. And you have all those years to enjoy it, and it's setting you up for success in the future. I'd like to tell you about Jane. She was sent into our office. 3 or 4 different people told her she needed to come in. Well, she lived an hour away and she didn't really feel like driving an hour to our office. I don't blame her. There are lots of doctors around where she lives, and so she didn't really see the need to drive out to Ann Arbor. Well, she had this run-in with her orthopedic surgeon where she had had not 1, not 2, but 3 orthopedic spine surgeries in the years leading up to her asking us for help. That's a lot of surgeries. That's a lot of spine surgeries. And what happened was they went in and they fused the lower part of her spine. And after she recovered from that, to her horror, she realized she wasn't feeling any better. So they went back and looked and said, you know what, we've got to do more surgery. And they did it. And then they did it a 3rd time. And she went back in and said, look, I'm taking 9 gabapentin every day. I'm on Norco. My legs hurt. I don't have control of my bowel. I don't have control of my bladder. This is miserable. And the orthopedic surgeon said, I know what we need to do. We actually need to do another surgery. And she was disappointed and said, look, I've already had 3 surgeries with you. I don't want to have another surgery. What are my other options? And he said, well, you know, it's the only thing I know. You've done therapy, you've done the injections, you've done more injections, we've done the surgery. The only thing I know is to do another surgery. And she said, well, there's this chiropractor in Ann Arbor that I've heard of, and I think I'd like to go check that out. And the orthopedic surgeon responded not the way most people would and not in the most professional way, but said, if you do that, you're not welcome back in this office. Now, why in the world somebody would say that, I don't know. I don't know why I don't know electricians that talk bad about plumbers or painters that talk bad about designers. I don't know why somebody would say that, but I don't know the guy. So maybe he didn't even say it, but that's what she said. So anyway, long story short, she came in within 6 weeks of her starting care. 6 weeks, that's it, of all these years. Her first surgery was 9 years before she came in. Within 6 weeks of starting care, Jane was off all of her pain medicine, every single pain that she was taking, the gabapentin, the Neurontin, the Norco, all the stuff she was taking was completely off it. Now, if you've ever had back pain, you know that wearing boots or heels is not the most comfortable. Well, within 6 weeks, she was feeling so much better. She put on her cowgirl boots, excuse me, picked her niece up, and they went to a Zac Brown concert in Detroit. Now, that is a huge difference. Her life may not be any better because she went to a concert. In fact, it was country music, so I don't know how much it could have helped her. But here's the point. Jane was able to avoid a 4th surgery. And not only was she able to avoid a 4th surgery, she actually allowed us to get to the cause of her problem and was able to start realizing her full God-given potential again. Time with family, travel, no pain medication, no more therapy, no more injections. It was a corrective procedure for her, and Jane was and continues to do a tremendous amount better. And it was very simple. She came in for a consultation. We did a posture check. We did nerve scans. We did digital x-rays, and we could see very, very easily. Now, they're proprietary scans. They're proprietary x-rays. That's not something that is available anywhere else. But that is how we were able to determine whether we could help her. And you know what? If we couldn't help her, we would have told her that. In fact, that's one of our promises is we will determine whether we can help. We get the information we need in one visit. That's all it takes. And then you have to come back for a second visit where we can tell you whether your situation is fixable or not. But very, very helpful for Jane. So the first thing I talked about was cellular repair with our high intensity laser. The second thing I talked about was blood flow with our Beamer microvascular therapy circulation procedure. That is very, very, very helpful. And then the third thing I want to talk about, and I think the most powerful, is alignment. Alignment is so important because it improves your nerve flow. Accidents and injuries that tear loose the connective tissue that hold your spine together cause a weakness in your spine, breaks down and locks in a stressed position. When it does that, one hip appears higher than the other. How many of you suffering with back pain already know you've got one hip higher than the other or lower? You've got one leg shorter than the other. How many of you already know that? Most people are aware of that. They just don't know that it's fixable. And I want to change that tonight. And that uneven alignment, just like driving your car out of alignment, will wear one tire down faster. It causes abnormal motion and then progressive wear and tear on every joint in the body. And friends, that's why people need in their mid to later decades of life, hip replacements and knee replacements. You can't carry 40 pounds off center, collapsed under gravity, out of alignment, and not wear those joints out. And what's more, if we're out of alignment, we're interfering with the body's nervous system function. And that is actually the biggest deal of all. Because the nerves in your low back, for example, control your bowel, your bladder, your reproductive system. They control how your hips, legs, and feet work. So if those nerves are pinched because the spine is out of alignment, it's also going to affect the function of everything those nerves feed. Guys, this is much, much bigger than back pain. And this is why we're so passionate about helping people get to the cause of their problems and not continue masking symptoms, covering up symptoms, because if you don't address the cause, it's going to continue to get worse over time. See, you're thinking about it wrong. You're thinking about it like your low back pain is the problem, right? That's what we think. And we go in and they x-ray our low back, and they x-ray and they do therapy on our low back, and they do injections on our low back, and they do all these things on our low back. And that's because you're thinking about it wrong. I'm telling you, you should think about it differently. Understand that even though it's loud, even though back pain is loud, it's typically a small sign of a much bigger problem. You can be dealing with cellular damage. You can be dealing with improper alignment. You can be dealing with improper nerve flow, which is affecting organs, blood vessels, glands, cells, tissues, systems. It is a very, very big deal. And so pain is actually just a sign that there's a much bigger problem. Where your spine is breaking down at the highest point, closest to where gravity hits you here, that is actually the most important part. Which is why, if this hasn't been addressed up here, there's been nothing corrective in your low back. The hips go out of alignment, not because the hips are out of alignment, but because the brain is in the wrong place and the hips will always be underneath the brain. And we've seen it thousands and thousands of times over the last 13 years here in our office, that when we get the head back where it needs to, the spine and hips will follow that. And it's nothing short of miraculous. The pressure comes off those joints, the body starts to untwist. By the way, we measure that to 1 millimeter. Within 1 millimeter, it's very, very specific. We have invested in best in world technology so that we can evaluate and tell you right away whether this is a problem for you or not. But you know what? If it's something else, you would have already felt better. If it's because your hips are out of alignment and it's not from the top, then having your hips put back in alignment would have fixed it, but it didn't. Or going to PT for a long time. I'm board certified in PT, but going to physical therapy 3 times a week and having the stretches done and the heat and the ice, and that might feel good. Some people, you know, are concerned because it hurts more sometimes when they do that. But regardless, if strengthening and stabilizing would have helped, then you would have already been feeling better, right? And what's scary is, if you're out of alignment and don't know it, or even if you do know it, if you strengthen and stabilize that, it's like cementing in the problem. We don't want you to strengthen or stabilize that yet. So chances are, if you're still dealing with this, no one has found the cause to your actual problem yet. And here's a clue, we're really good at finding this out. One of the most common questions I get is, Dr. Lazar, are you able to tell if my problem can be fixed? And the answer is yes. Every month, we offer 4 time slots for an in-office consultation with one of the doctors on our team. And one of our doctors will sit down, we'll meet with people just like you, and we'll determine if their low back pain, if your low back pain is fixable or not. If it is, we'll tell you exactly what we have to do to do it. It's a 2-visit commitment. The first visit, we do a consultation, we dig into your history, we do a posture check, we do nerve scans, we do digital x-rays. It's very, very thorough. It's by far the most thorough assessment you'll ever have. And then you come back for the second visit after we've had time to analyze everything. And that's where we tell you whether it's fixable or not. But here's our promise. If it's fixable, we will tell you, and we'll tell you exactly what needs to be done to fix it. If it's not fixable, we will have the name or names of somebody that we think can help you based on the assessment that we do. Now, our assessment is different because I teach at 3 chiropractic schools. I love it. I'm passionate about it. And we have picked the best of the best and put that together in one proprietary assessment. And people literally travel from all over the world to get the assessment. We think it's very worth it. Even in the situations where we can't help somebody directly, it's never a waste because we can tell you whether it's fixable or not, even if we can't do it. And I think that that's very, very important. So if you're interested in applying for one of those 4 time slots we have monthly, I believe we have 3 left for the month of September. If you're watching this live, if it's after that, you can still apply. It might just be for, months down the road, a month or 2 or whatever the next slot is available. But there's a good chance that you getting this information can help you. We really want that for you. But we believe that if we can find the cause of your problem, and fix it, that can have a much greater impact on your life. And we know that to be true because of the stories that we have seen over and over again. So what I'm going to do is I'm going to share my screen. Give me just 1 second here. And let's see if I do this right. All right, so on your screen, you should see a QR code. And if you use your phone and you snap, you open your phone's camera, but you don't actually take a picture of it, you just let it grab it, you can grab this QR code to apply. I'm also going to type in here, just in case the QR code doesn't work for you. If you go to drlazar.com /back app. We don't have an app for you. What it is, there we go, is that's where you can apply for one of those time slots. drlazar.com /back app. You're actually applying for the back pain and sciatica solution. All right. So that's what the QR code is for here. Or you can just go to lazarspinalcare.com /back app. I don't like to give you two options, but this is a backup in case the QR code isn't working on your phone or on your camera, or if your phone's not handy. All right. So drlazar.com /back app. The reason that is so important is because we really want to help you function a ton better. Now, whether you have never been to a chiropractor before, whether you have never asked for help before, this is something new for you, or whether you've been like Jane and had years of problems and every pill under the sun and every injection and every gadget and every doctor's appointment and surgeries and all sort of things. This is still an incredible opportunity for you, because we want to make sure that we can get to the cause of your problem and want to see if we can get you some real results and help you get back to enjoying life again. All right, so if you apply for one of the 4 consultations, there are 3 left for the month of September. If you don't get one in September, your application will be forwarded for another month. But if you do that before the end of the webinar tonight, before you're done watching this, if you do that, we're going to include with your consultation, examination, x-ray, we're going to include a laser session that we talked about, and we're going to include a beamer session, a circulation therapy session. If you do that before the end of this, if your timestamp on the application is before this talk is done this evening, then you will get those additional bonuses. If it's after that, we still are happy to let you apply for one of those consultations, but you just would not get the laser and the beamer option. Now, what would have happened had Jane heard this before she went in for therapy the first time, or injections the first time, or surgery the first time, or surgery the second time, or surgery the third time? See, there's a cost to inaction. Our concern is that anytime there's a problem and it's short-term or acute, that it will become a chronic problem. And that's not good. And anytime there's a chronic problem that's left uncorrected, it will become permanent, and we don't want that for you. We don't want you to wait too late. There was another lady that came in, and she did not start care when she came in. We did an evaluation, we determined we could help her, and she didn't start care. And 4 years later, she came back, only this time she was in a wheelchair. She wasn't using a walker anymore. And she had a 16-degree curve in her low back and the small of her back. And when she came back 4 years later, it was a 35-degree curve. She needed much more care. It was much more expensive, and it was much less fixable. And we really, really don't want that for you. If you're watching this, I believe it's for a reason. So there are several people who we've talked to who they weren't going to do it, but they were glad they finally did, and they regretted that they didn't do it sooner. We hear that all the time. A guy today was just telling me he's got 95% of the function, the feeling, back in his lower leg. He had lost all feeling in his lower leg because of nerve damage, and that his 95% returned after about a month and a half. All right, so this is a risk-free opportunity for you because number one, it doesn't cost anything for you to apply. So I definitely think that would be an appropriate next step. But if we go through the examination, x-rays, and we determine that we can't help you, we find, hey, this is not something that's fixable, we will actually refund your money for that because we don't want there to be any risk whatsoever to you. You might think that it's going to be salesy or pitchy. Well, first of all, we're in healthcare. We're a team of doctors. We don't have anything to sell you. If we can help you, then we'll tell you. Just like the orthodontist doesn't have anything to sell you. If you want your kids' teeth to be straight, they can put braces on, they cannot. Totally up to you. You might think, well, I don't really need this. Again, if it ain't broke, don't fix it. I don't really need it. I feel fine. Well, the challenge with that is only 9% of your nervous system transmits pain, which means if you're not feeling pain, while that's really cool, it doesn't mean that there's nothing wrong. And so we actually think that it's most prudent to have your spinal alignment and nervous system evaluated anyway, just like you have your teeth checked or your eyes checked. We think that that's really, really, really important. You might think that this doesn't really apply to you. Again, it's worth checking if we can prevent something from developing or becoming permanent. That's really positive. Or you might think, hey, it doesn't apply to me, but there's somebody in my life that I care about. Well, we certainly think that hope should be passed on to other people. And so, people are afraid sometimes to come in, not because we're mean or not because we're scary, but honestly, people can be afraid sometimes of what we're going to find. And I would ask you to wait to worry about that. I would ask you to consider if there's a chance that we can find a problem that's fixable and you can get back to enjoying your life again with the peace of mind of not worrying about whether you can run that sprint or play with the kids or get up out of that chair or travel in the car without the sciatic nerve pain just clenching so tightly that it feels like somebody's poking you in the behind. We don't want you to worry about that. We want your attention to be on things that matter, like your faith and your family and your impact and your legacy and your work and your ministry and your career. That's what we want you focused on. We don't want the noise of pain in your body or the fear that things might get worse or become permanent or that it's not fixable. We don't want that to be there. So if you're afraid of what we'll find, please just wait on that. Wait to see. Are there times we find stuff that's scary? Sure, there are times. But it's still really, really, really important to find out. And so we hope that you'll take us up on that. If you will, just picture a day with me where you can get up in the morning and not have to take 15, 20 minutes to move and stretch and you have a hard time putting your socks on or walking to the mailbox. Picture a day where that's not the case anymore. You get up and you're full of life and you're able to move around again. Or picture a day where you can plan ahead and say, I don't have to wait for a good day or worry about it being a bad day. I want to plan ahead, and I want to I'm able to plan ahead. I don't have to be living in fear any longer because this is working well for me. Or picture a day where you don't have to take the pain medication that you're concerned is going to cause more problems somewhere else. And you don't have to go to, your physical therapy appointment and then go to your pain management appointment and then go have injections and then go have all these other things done. Picture a day where the cause of the problem has actually been addressed and you're enjoying life again. That's what we want you to picture. So I'm going to put this up one more time, and then I'm going to close with a really, really important story. So drlazar.com/back app to apply for one of the 3 of 4 available slots we have the rest of September. You can use the QR code or you can use the URL, drlazar.com/back app. So I'm going to take this away in about 10 seconds, and then I want to share a really, really powerful story with you. Again, if you apply for this before this workshop is done, I will include with your consultation and assessment a laser therapy session. That's an additional $79 value, and a circulation therapy session. That's an additional $49 value. Absolutely included. We want to make sure that we get you the most help as quickly as possible. So grab the QR code or go to drlazar.com/back app to apply for one of those consultation positions. All right. So I was born in a home with love and faith, and my mom was a nurse, and I was on 9 prescription medications, and some of those were for pain by the time I left for college. It wasn't fun. My brother also was raised in the same home and had to have some surgeries for some injuries he got while being an EMT, and was really passionate about helping people that way. Well, Doug was prescribed 2 medications that can't be taken together. And as a result of that, in 2007, Doug died. His heart stopped. He was 35 years old. And it was, and is to this day, a really, really, really sad, crummy situation. And I share that with you because this opioid epidemic is not something that's just a catchy title. It's a big deal. And if we're feeling better and we don't have to take the pain medication any longer, and we don't have to be a slave to the schedules of these doctor appointments and pre-authorizations and insurance claims, and, isn't it time we just fix it? Just get back to enjoying life again. Just stop taking the drugs. Just stop worrying about the surgeries. Just stop worrying about all the appointments. We think it is. And so we would love to see if we can help you. We would love to see if we can help you reduce the medications you're on, or cancel a surgery like Jane, or like Mr. Jones, how he was able to cancel his surgery. That is really our hope for you. And we believe that the world deserves you at your best. And we would love to see if that's something we can help with. Thank you so, so much for joining. I don't take it lightly that you've chosen to spend this time with us. We're very, very grateful. On behalf of our entire team, thank you very much for joining. And we look forward to reviewing your application for those consultation time slots. Have a wonderful evening. I'm Dr. Lazar. We look forward to seeing you soon.